Points for reactivity. He's pretty good behind the shoulder, and then when we hit about bladder 17 to about 23, 24, this is the right side, we get a pretty strong positive reaction, not so much coming through the croup, and he's really quiet actually through hock and stifle points back here. He is positive over hip points, that's hip joint, a little bit at hip soft tissue, but predominantly coming through the back and the loin. Let's go over to the left side.
Say that again because you weren't recording.
Okay, left side scan, bladder meridian, pretty quiet behind the shoulder. That's bladder 13, 14, 15. We get a little bit at 16. 17 is very strong, very reactive all the way through his low back. Again, kind of quiet through croup next to sacrum. Pretty darn quiet coming through the bicipital groove, which is a surprise, but he's pretty non-reactive. Positive again to hip joint, strongly so on the left side. Those are joint points. And bladder 54 also hip soft tissue on the left. So this area up here in his loin, the peri-lumbars, is a little bit overdeveloped on both sides. Obviously more than we'd like to see, so we've got some chronic reactivity pain in the low back. He's also a little bit resentful of the right stifle palpation and has a swivel on the right hind. And that's good. We'll send that over to her so she can at least... You ready?
There you go. You're on.
Okay. So this is post-aquapuncture. We did acupuncture at bladder 21, bladder 23, Bai Hui, Shenshu, bladder 54, bladder 40 on the right. So just coming back through and checking this meridian again to show the difference in reactivity before and after treatment, and also having some lumbar adjustments as well. You can see that we're still giving him pretty strong pressure on the scan here. And we're really not getting the reactivity, still a little bit up here, really not getting the reactivity that we had before treatment. So I would suspect that the muscle reactivity that I was getting up top is secondary, and that's why it's important that we went ahead and treated him anyway to try to get the pain under control. Let's go see what we got on the right. Come through and check this side. So pretty significant difference compared to where we started with him. So same thing, acupuncture on this side, vitamin B12, treat the muscles and the nervous system, and not a lot now of reactivity. So worthwhile to treat him and address that muscle pain, but I still think he probably needs to go and have workup for the underlying cause.